Okay, great. Well, thanks for joining us, everybody. I think we'll go ahead and start. Thank you for joining either over Zoom or Facebook. I know some of you have made time out of your very busy schedules to join and share updates about your organization, and we really appreciate it. My name is Rais Vohra. I'm the Interim Health Officer for Fresno County Department of Public Health, and I will start with case counts and then introduce our guest speakers and presenters after that. So for today, the total number of cases that will be updated to our website, or actually they're already updated to our website, is 777. And that includes 44 travel-related, 302 close contact, 293 community spread, and 139 which are under investigation. We also have a total number of deaths registered as 9, as previously. And the number of recovered is now 263. And the number of active cases that we are currently following is 505. The number that have ever been hospitalized is 114. And that includes patients that are currently in our hospitals and ICUs. Currently, we have 27 patients that have either confirmed or suspected COVID-19 in our ICUs throughout the county, and approximately 50 to 70 patients that have either confirmed or suspected COVID-19 that are otherwise hospitalized in the county of Fresno. Lots more data and surveillance dashboards that are available on our website. We also have joining us today Dr. Stephanie Koch-Kumar, who is our senior epidemiologist, in case you have any questions about our epidemiology trends. And we will make time for questions after we get a few updates from our guest speakers. I'd like to introduce them right now, and then we will go through and talk about each of their roles and responsibilities in various aspects of this pandemic response. I'm very pleased that we have from the city of Sanger, Mayor Frank Gonzales, and I don't know if Tim is on as well, but Tim Chapa and Frank Gonzales from the city of Sanger. Thank you so much for joining us, Mayor, and making time for us.
Oh, it's my pleasure to be here and contribute to the overall testing of the entire county and state and actually the nation. So I'm very glad to be here.
We are so glad that you joined us as well, because we wanted to make this announcement together. We've hinted at this in the last couple of days, but the state of California has granted a testing site asset, and through collaborating with the city of Sanger, we're going to be able to offer testing in the same model that we have here at Fresno City College in the city of Sanger itself. Can you tell us more about where it's going to be and how that's going, Mayor Gonzales?
Well, yeah, you know what? We were looking at different places in the city of Sanger. We ultimately, the best place to put this is a place that everybody knows in the city, for one. It's kind of a central place in the city of Sanger. It'll be at the Sanger Community Center. And you know what, we all of our Parks and Rec events are pretty much on hold right now, canceled. So therein lies an empty building for us to utilize for different things. And this is probably one of the best things that out of all this mess, helping out the community and opening up a testing facility there for not only the citizens of Sanger, which I'm happy about. They don't have to travel very far. It's just up the street for them. But also the region, all the rural communities. There's a lot of like Orange Cove and nearby towns like unincorporated ones like Del Rey. There's Reedley and Dinu, but they could all come to the city of Sanger now.
Yes, sir, and we really appreciate it. The registration to get tested will be available online. It will actually be the same website that we offer for the Fresno City College site, and that's actually already on our website. If you look under the testing sites, and people can just get an account and register online, and then just pick a date and a time. Be prepared to do that on Monday. That's when our start date is for when people can actually get registered. And in the meantime, we're working very hard with the mayor's team and with the city of Sanger to make sure that all of our ducks are in a row, and that we'll be ready to swab up to 130 people per day in the city of Sanger to offer free testing for whoever needs it, whether they have symptoms or if they don't have symptoms, they can just get up there and get it done. And I imagine there's plenty of parking available as well, right, Mayor Gonzales?
Yes, sir. Yes, sir. That was one of the main reasons we chose that place, because you know what? There's parking all the way around that facility. We're basically ready to go, and I can't tell you how happy I am to be working with the county, the state, and you know, even at the federal level. You know, bringing this testing facility to a little old town, the city of Sanger is actually pretty exciting for us.
It's super important. Like you said, we really want to serve our rural communities. And really, we hope that this is something that the whole county can take advantage of. We will certainly be sending people to get tested there as soon as that site is ready. And we're so glad that that Sanger is part of the solution as we all come together for this pandemic response. So thank you very much. We really appreciate you joining us, and we appreciate all of your support throughout this project.
Thank you. Like they always say, we're all in this together. So we're
right.
very happy to help out.
Does anyone have any questions for Mayor Gonzales at this time, or any questions for our team about this site? I think there was a question that we got emailed about the number of tests, and like I said, the state really wants 132 tests done every day. That's how many the team is capable of doing at these sites. In terms of what's happening at Fresno City College, on our first day we did 60. On our second day we did 100. We're still waiting to hear about our third day, which is today. But we're rapidly ramping up to do dozens and up to 130 tests per day, just as people get registered for it. We also have a phone number that you can call, and we will display that prominently on our website. So if you don't have access to the web registration, don't let that be a barrier. You can just go ahead and call our number at 600-3332 and request registration for the testing sites. Or there's a 1-800 number that the vendor called OptumServe is also offering to do direct registration through them. So we will definitely get you registered regardless of if you have an online account or not. But the easiest way to do it is by creating your own online account, and that will not only get you registered, but it will also be a good mechanism for them to contact you with your test results as well. So thank you very much, Mayor Gonzales.
All right,
any questions for the mayor while we have him on our call?
Hey, I have a quick question. This is Kirsten with KC24 and CBS 47. Just the question for the mayor. Can you talk a little bit about how the city of Sanger is doing as far as the COVID cases and kind of what challenges you guys are facing being a little bit more rural than other cities? Obviously, testing is a big one, I imagine.
Yeah, that's one of the bigger ones is the testing part. Yes. Another thing is just getting the word out there and having the people, you know, realize that this is a real emergency. You know, I noticed that our numbers in Sanger were you know, going up quite a bit. You know, I told everybody, just, you know, nobody needs to panic. Just be sure to take care of yourself, take care of your loved ones. Make sure you do the things that have been talked about from the POTUS all the way down to me, the city mayor. You know, if you're sick, stay home. Please wash your hands. You know, all of the social distancing things. But you know, just trying to get that message out there as best I can. You know, I use every medium I can do. You know, social media. You know, our utility mail-in thing. All the information is on there. Our website. We put flyers around town, and you know, just word of mouth. And I tell everybody, you know what? If you know somebody doesn't have access to an email or even just a phone, just go over there and let them know, you know, what's going on. Because like I said, everybody's in this together. Thank you.
Great question. I just want to echo exactly what the mayor said. We really are all in this together. This is requiring a lot of learning for the medical professionals, but also for our civic leaders like the mayor, and also for the general public. So we're all learning and teaching each other together about best practices and about the best ways to get good medical information out to people who need it. So we always appreciate whenever civic leaders are willing to work with us. And that actually leads to the next point, that we're not done collaborating with the city of Sanger. We want every one of our cities to really help us do another important phase in getting ready to get into the next phase of recovery, which is with the contact tracing. And so what we'd really like is for all of our civic leaders and really all of our organizations to learn about contact tracing and to really help us do best practices with the way that gets done. So we'll be speaking with the mayor's team and really with all of the different cities all around our county about contact tracing, because we understand that along with testing, that's going to be another important pillar on the roadmap that we need to have established. And that will include some online courses that people will need to take to learn exactly what that is, as well as some real world exercises and really best practices that we will all figure out about how to get contact tracing done. Every community is different. As you said, Kelsey, that some of the rural communities have different challenges compared to some of the urban communities. Employers have different challenges than households. Schools are different from hospitals, but all of us have different vulnerabilities when it comes to COVID-19, and all of us need to understand what our own individual vulnerabilities may be wherever we work, and that's going to require a lot of dialogue related to this. So lots more to come, lots more to teach each other, but hopefully we can all work together to keep our community safe and to protect ourselves as we tiptoe into the next phases and get more and more sectors opened up.
Dr. Vohra, this is Tad Weber with the B. I just wanted to double check if I heard correctly. So the state wants a minimum of 130 tests a day. Is that for the whole county or is that per test site? How does that work?
Yes, sir. So this is actually national guidance. It's not really a requirement. It's just best practices. But epidemiologists have really set forth a standard that, for every 1,000 people in your population, you should have 152 tests being done, for every 100,000 people in your population, which in our county equates to about 1,500 tests that we need to do every single day here in the county of Fresno. We are inching towards that goal. We're not at goal yet, but again, news like what the mayor is sharing is just fantastic because it just means that we are that much closer to our goal of 1,500 by adding these 132 tests every day. That will go into our overall daily goal. And we feel like we're getting there just by adding more and more capacity like this. So we will continue to do that. Another bottleneck that we've really been able to overcome is the test kits. And so the CDC as well as UCSF have really been able to send our community lots and lots of test kits, like on the order of thousands. We've got about 5,000 that were sent to us by the CDC. I see Brandy Nikaido from UCSF Fresno is here. And she was able to share along with her team that UCSF main campus was able to deploy another 5,000 tests to be used at the UCSF Fresno Medical Center and community regional medical centers. So again, just great news when it comes to testing because we are helping to meet the challenges and overcome some of the bottlenecks that we were experiencing as recently as last week. And we really hope that hopefully in a week or two, we will be at that goal of 1,500 tests per day, which will really position us to meet the needs of surveillance, testing, and just making sure that our communities stay as safe as possible. Thanks, Tad. Any other questions for Mayor Gonzales or about testing in general?
Can you guys hear me?
Yes.
Hi, sorry, kind of new to the press conference in Fresno. My name is Angela Hart. I'm a reporter with Kaiser Health News.
Great.
I'll talk here because I'm looking at a screen over here. I'm I wanted to ask the mayor, Mayor Gonzalez, I wanted to ask you a question. I wanted to ask also maybe the health officer or the mayor, whoever wants to jump in. Just two questions about some of the more vulnerable communities. We're hearing that there's some challenges getting the word out to maybe some people who don't have insurance or low-income populations about getting testing. Are you guys having that challenge here? I guess that's the first one. Do you want me to do the other one now, or do you want me to wait?
Either way, that's a great question. It's something that we are definitely focusing on. We're trying to reach really the diversity of the communities that we have in Fresno County. We know that we have people that may not speak English, so we're really trying to do some Spanish language and even Hmong and Punjabi language messaging related to COVID best practices, prevention, what people can do if they do come down with symptoms. And we've been doing that for many weeks. We know that it's time to change our messaging a little bit, just because things are changing at the state level and maybe at the local level with how things are slowly opening up. And so we know that we need to get more messaging out there just to craft messages that are responsive to this current time. Beyond that, the question that you asked about insurance is a great one. That's really a universal concern that people have is, how can they afford to get this testing done, especially in this time of great economic hardship. And I think that whenever people hear the best information that's available, that's actually reassuring, because the test that we're offering through the City of Sanger and also the Fresno City College is totally free, and all of the services that we offer through the Department of Public Health in terms of follow-up and contact tracing are also coming without charge to the individual patient. And beyond that, we're happy to help troubleshoot any other challenges in terms of economic hardships that people may be having for the rest of their medical care. And that's just something that has to be done on a case-by-case basis. But yeah,
you're saying that is a challenge, though?
Out there. Oh,
you're saying that is a challenge, though? That is a challenge, though, you're saying, even though the testing is free, getting the word out to people who don't know that?
Yes, we've heard that some people don't understand that the testing, should not cost anything. If you have insurance, your insurance should cover it. If you don't have insurance, don't let that be a barrier. And so, every opportunity that we get to explain that to people, we're taking advantage of that. And we're trying to be sensitive to all of the different populations that we serve.
And then Mayor Gonzalez, the other vulnerable, I just wonder, well, it doesn't have to be you specifically, but another vulnerable population is homeless people. And I'm not really that familiar with how much of a problem that is in your community, but I wonder if there is concern as the state slowly reopens, is there concern that these infections are going to grow in those homeless communities? And I don't know if the state could help out a little bit more. What do you guys need?
Well, on your first question, that is going to be, getting the message out there, because that's what I hear a lot of times is some of the citizens that, they don't want to go to the doctor. They don't want to get a test because they can't afford it. So, getting that word out there and making sure that they understand, hey, this is going to be free for y'all. So just come and get your test done. The other thing that we're doing with the county, and with the county, I can't express how much gratitude I have for them, because they have been reaching out to the city of Sanger on a daily basis and going out and screening homeless people to find out, hey, do you feel good? Do you have a fever? If not, this is where we're going to take you to get a test. And that working along, hand in hand with the county has been kind of a godsend, because in the city of Sanger, the homeless population isn't that, one person homeless is bad, but it hasn't reached like the hundreds of people or anything like that. We're still pretty low. But with that said, the county has been coming out and doing just follow-ups with homeless people, just to make sure that they know that, hey, they have somebody on their side and looking out for them.
Yeah, and we've deployed shelter accommodations. I feel like this pandemic, the silver lining has been how much has been done to help homeless populations throughout the county. And Dewan Utek, who's our director of behavioral health, I don't know if she's on today, she sometimes joins our calls, has been instrumental in spearheading so many of the initiatives related to really bolstering all of the services that the homeless populations are able to receive. We've been able to set up iPads that have telemedicine connections to one of our primary care clinic systems, so that each one of our homeless accommodations and shelters that have been set up have that remote telemedicine connection as soon as somebody has any symptoms at all, whether they're related to COVID or something else. We're also planning out surveillance testing in our homeless shelters and populations. That's something that we're still working through the logistics of, and making sure that we have really everyone's questions answered before we embark on that. But that is something that we think is a priority, just to make sure that those congregate settings, just like our other congregate settings, like our nursing homes and our jails, et cetera, really all of these congregate settings are vulnerable populations. And so we want to pay extra attention to them to make sure that they have really as proactive of an approach as we can provide. And thirdly, like the mayor said, we're really focusing on screening people every single day, even outside of the testing, to make sure that we catch people that have symptoms and make sure that they have everything they need to isolate or quarantine so that their infection doesn't get spread. All right, thank you so much. Once again, thank you to Mayor Gonzalez. I really appreciate you joining us, and look forward to coming out. I'm actually scheduled to come out tomorrow and see the site myself, along with Dave Palmaville, and we really do appreciate your whole team's support. This is moving so quickly. I think we just started talking about this around this time last week, and here we are, ready to make this announcement for our community. So I couldn't be happier with how fast and how collaborative your team has been. Thank you so much.
And thank you. Yes, have a good one.
Great, thank you. Okay, our next guest speaker is Stephanie Torralva from the Amor Foundation. Stephanie, are you on?
Yes, I'm here.
Fantastic. So I think, you know, the Amor Foundation is probably something familiar to a lot of us here on this call, but if you could spend a few minutes talking about that, and then also talking about the testing initiative that we've been able to embark on with your group in Mendota, that would be fantastic.
Yes, of course. So, of course, the Amor, Amor is we're a local nonprofit, but we recently have gone into constructing our 2-building. It's a health clinic and neighborhood resource center in Mendota. It should be open, fingers crossed, if everything goes well, by this summer. And so we primarily service the community of Mendota. And now with COVID happening, we know that there's a huge need just to really ease people's fears and worries, and then of course getting a little bit deeper and actually doing the testing. So I would also like to say thank you to you, Dr. Vohra, because we moved really quickly. As far as I know, there are a little over almost 30 cases, I think, in Mendota. And they face very unique challenges, and that's a lot of times they can not practice social distancing. A lot of families there are multiple families living in a small area, up to 20 people sometimes in a home. And so if any one of them gets sick, it's really hard to self-quarantine. So not only that, but there are a lot of just rumors and fears, and we're doing our best to ease those. And on the other side of that, like I said, our facility is not yet open. So we are working.
I'm wondering if you have a couple minutes still today. I hear myself. Thanks.
Oh.
Oops.
I think you're back on.
Sorry. Okay. Yes. And so we are just trying to do what we can without having our facility open yet. And that's what we're doing now. Actually, as we speak, there are testing right now in Mendota in the parking lot of our soon-to-be facility. And yeah,
So that's happening right now. So
as we speak, yeah.
This afternoon, Madera Community Hospital, who's actually our other partner with this, is actually out in Mendota. And so hopefully if folks are live streaming and they're out in the Mendota area, then please get out there and get swabbed if you need it, or tell your family members. Madera Community Hospital, again, very quickly stepped up and put together this swab clinic with the help of Amor at their site in Mendota. And so we couldn't be happier that this is going on. Anytime we can increase the number of, especially rural sites that we're able to do surveillance testing, we're more than happy to have that happen. So thank you again for helping with that, Stephanie.
Yes, of course. I mean, we're happy to do it. That's what we're here for. And I would also just like to add, I think this is it alleviates a big, I don't know, I guess pressure you could say, or just a hurdle for this community. As a lot of them are undocumented, they have a lot of questions surrounding what kind of resources they can access during the pandemic. And so being able to offer this free test is just putting a lot of them at ease now. And yeah, it's really helpful.
That's fantastic. And it sounds like this testing it will be open till 7 p.m. tonight.
Right? That's right.
Okay, great. And hopefully, if not today, then we can set up another one later and hopefully give people a little bit more advance notice. But again, this came together very quickly. I couldn't be happier with how agile this team is. So thank you, Stephanie, for everything that you've done on behalf of the population of Mendota. We really appreciate it.
Of course. Thank you for making it happen.
Sure, yeah. And actually, the Valley Health team will be doing swabs in Mendota at the Rojas Pierce Park on Friday as well. So we actually have 2 opportunities for all of the residents in Mendota to get tested, either this afternoon until 7 p.m. today, or Friday afternoon 3 to 6 at the Rojas Pierce Park. And that information will be featured on our website as well. Thank you so much, Stephanie.
Of course, no problem.
Appreciate it. We look forward to collaborating further. And again, just another amazing thing that the Amor Foundation is doing out of all of the great projects that you've undertaken. So thank you.
Thank you.
Any questions for Stephanie or about the Mendota Rural Surveillance Clinic that we're offering? All right. I'd like to now introduce one of our out-of-state guests, Barnaby Dow. Welcome, Barnaby, and thank you so much for making time to join us today. I take it you're in Washington State, is that right?
Yeah, that's right. I'm talking to you from our Emergency Operations Center, which is in Renton, a town just a few miles south of Seattle.
Renton, Washington. This is so great. I won't belabor how we got to connect, but it was through one of our stellar team members here, William Edmonds, who I think listened to you present about King County emergency management, which I see you're wearing the King County shirt today. So please tell us about your role, and then I would actually just like to pick your brain here on live media, just about some of the fantastic work you've been doing in King County.
Well, out here at our Emergency Operations Center, we act in support of our HMAC Health Medical Area Command. I run a joint information center that's plugged into the 39 different cities that make up King County, and we work to coordinate messaging. Our caseload, we got about 2.2 million people in King County. So for a frame of reference for you, our caseload right now is at 6,770 confirmed cases. That's up 117 positives from yesterday, and 474 deaths. That's up 7 from yesterday. So in terms of King County, which is of course was one of the early spikes, we're bending the curve pretty well. We've got our R0 below 1. It's down to about 0.62, depending on what series of metrics you're looking at. So all of our messaging is driving folks into a new, what we call 4 phases of potentially reopening counties and the state that's been laid down by Governor Jay Inslee. And
Okay.
we're closely following the metrics behind that to decide where we'll go. Right now we're in phase one, which is everybody can go hiking, you can go to your most of your local parks, but social distancing. And like y'all, we got to get our testing numbers way up from where they are right now.
Sure. Okay. Great. And as I understand it, obviously Washington State, and especially where you live, like you said, experienced the case count going up even before we did here in California. And you also experienced an outbreak in your skilled nursing population.
That's right.
And obviously we read that. I have the CDC paper about King County right here in front of me. Could you talk a little bit about what your role was and how that played out, and whether that's still an issue where you are?
Yeah, just very, very briefly, long-term care facilities remain a focal point of the effort right now. They are hotspots at King County. I don't have the numbers right now, but you can get to them through our public health website. There continues to be a major concern, and our messaging is reflecting on that notion. At first we had strike teams that included CDC, but now we formed our own. Public health has formed its own, and they're at standby and deployed in the field every day. And as this R0 shrinks, contact tracing is going to become a huge part of what we do. And getting a much more satisfactory resolution of what's going on in the long-term care facilities is on the tip of that spear.
Great. Yeah, thank you for sharing that. Can you speak a little bit about some of the, I guess, prevention or proactive measures that the nursing homes were able to take on, or something that you were involved with?
Well, of course, first off is social distancing and making sure that each of the facilities had patients identified and tested properly, including the staff. And the curve on that was, as everyone else has experienced, a little steep. Right now, I can't speak. I'm not an expert. I can't speak to the protocols that are being applied specifically site to site, other than to say they're just much more intensive than they were even a week ago or 2 weeks ago. So I'm sorry I can't give you a better answer on that.
Oh no, that's
I'm
fine.
a flack, so you know how that goes.
Thank you so much. We really appreciate you taking time to be here and really to field questions from us. I'll go ahead and open it up to see if anyone else has questions from our media partners. Anything about the situation in the Washington State or in King County where Barnaby operates.
You know, our phased approach to recovery is very similar to what California is, and that's a product of the close cooperation between our governors and governors of other states, including Oregon.
What's your feeling of when you'll go into the next phase?
We just entered phase 1 yesterday with the opening of parks and reintroduction of some construction activities.
Okay.
We're gonna wait 3 to 4 weeks. And when the testing, if we can get the testing up to the level we want it at, we hope to have brigades of testers of over 2,000 people ready and on the ground by June 1st. If they produce results that we're looking for that say that R0 is acceptable, remains below 1, hopefully far below 1, then we'll go to phase 2, which is a lessening of those restrictions and more opening of public places, such as limited entry to restaurants and other activities. And then 2 other phases after that, which will likely stretch into July if everything goes well.
Great. Well, thank you so much. We really appreciate you being here. We really look to you for a lot of the insights that you and your group have provided. Washington State Public Health is a national leader in so many public health different projects, but especially with COVID, just given your experience and insights very early on. So we look to really all of the providers and public health personnel in Washington State, and we appreciate you spending time and teaching us about your experiences.
Thank you. I appreciate this venue because other experiences, I've already been taking a lot of notes on this, and alternate experiences are incredibly important to what we do. Also, happy National Nurses Week, everybody.
Thank you. Yeah, that's very important. Yeah, thank you so much for mentioning that.
Yeah, we're all going to need one sooner or later.
That's true. Great. Any more questions for Mr. Dow? Barnaby Dow, thank you so much for joining us. We also have our senior epidemiologist, Dr. Ko Kumar, on the line here in case anyone has any questions for Dr. Ko Kumar. And as I understand it, we've already added new features to our website. Is that right, Dr. K?
So the new feature should be coming shortly.
Oh, okay, gotcha.
I would like to answer, there is a question on chat about R0. So R0 is the reproduction number. And what this tells you is how many cases one case is likely to spread it to. So to stop the spread, you want to get that number less than 1. So less than 1, you don't really see that community spread. If it's 1, that means that every 1 case is spreading it to 1 more case. 2 means on average, 1 case is spreading it to 2 more people. So that's what R0 is. So we're trying to get that below 1.
Do you have an estimation of what it is here for Fresno County or here in California?
So I will say that the formula for that is fairly complex. So we have to wait till we see a little more cases to get a better idea on that one.
I see. Okay. Great. I'm sure it relates somehow to doubling time, which is how my mind understands that. But I think both of them refer to the whole flattening the curve. And these are just different ways that we can measure that we've flattened the curve.
Maybe a quick question for Dr. Kumar. This is Jim from JP Wire. Dr. Kumar, I know we had talked about this last week and the week before even, hospital data on testing in Fresno County. Are we getting to a point where that data will then get funneled into the site as well, so we have a better idea of how many tests we're doing?
So all data technically is supposed to be reported if it's any test that's done within the county is supposed to go through this centralized system and end up into our counts. The problem right now is we don't really know the pending because we have to wait until we have actual results. And so that's where the delay, the biggest delay is coming from, is that we can't tell you how many tests are going on right now. We have to tell how many test results that we have is the biggest drawback.
I have a question. Oh, sorry. I have a question for Dr. Kumar. On the public health site, I think Dr. Vohra had told me there's data indicating racial breakdowns from the testing that's been done. Is that correct?
So right now we have the breakdown of cases by race ethnicity, and that's going to be incidence per 100,000. So that takes into account the different population sizes of those groups. When it comes to testing by race ethnicity, unfortunately, when we get negative labs reported, a lot of times these are being reported by labs directly and not by providers. When that happens, we don't always have demographics. So about over 4,000 tests at this point do not have that demographic data. So although we can break it down by race ethnicity, it's not great when it comes to testing because we have such a lack of available data. So there's a wide number of unknowns. So we're sticking to just cases at this point.
It's very similar to King County, by the way, the rates.
Interesting.
And I would like to note that all data on this website is to be considered preliminary and is subject to change. So frequently with disease reporting, we actually wait a minimum of several months to even, you'll see with cancer, it's 2 years delayed in reporting. That is so that you can get complete pictures of what the data is happening, get those delayed reports, and be able to clean up the data. We're trying to report real-time data. So what's happening is we're reporting during investigations. So as those investigations are closing, some of those numbers, even historical data, might change as we find out more in the cases as we clean the data. So just be aware that some of those day counts might fluctuate as we learn more about the case.
Great.
Dr. Vohra, there was a rally at City Hall today, Fresno City Hall downtown, Freedom Rally. One of the city council members says, well, there's only been 9 deaths in the entire county. We need to open up. And I wanted to show you a picture that my colleagues took down there. Just looking at what the rally looked like. Does that picture there kind of concern you as far as, you know, lack of social distancing? I don't really see too many face masks either. What are your thoughts on that? And we talked about the city of Clovis yesterday not enforcing the governor's shelter-in-place order either. Is it tougher to keep that, I guess, or not, under one when you're seeing pictures like that? Cities like Clovis right next door, I mean, people move around, right?
Yeah, you know, I think wherever people are, the best practices that are advised should really be minded, and that includes keeping your distance and making sure that that you're far enough away from other people so that you can be protected. And then obviously, if you're out in public spaces, there's a strong recommendation to go ahead and wear masks. Because if everyone wears masks, that will also provide another layer of protection. So I would encourage really everyone in the county to be mindful of those 2 reminders, no matter what you're doing, whether that's going on a grocery errand or participating in a rally like this. Those are really the best things that you can be doing at this time. I can understand that there's impatience, to say the least. And maybe even some anxiety and a lot of enthusiasm to get into a later phase than where we are. But I also have to remind everyone that we're in a very fragile situation when it comes to our healthcare safety net, really just what's going on in some of our very vulnerable populations. Yes, that includes nursing homes, but it also includes, our employers, and it includes our places that are currently open that are working hard to put food on our tables with our food supply lines. And really, whatever we can do to protect all of these folks is really something that we need to be mindful of. And so, there's good reason that we're reminding everybody to be mindful of hygiene, to be mindful of social distancing, to go ahead and wear a mask whenever you're out in public. It's because we want you and your families to stay safe. And I think that hopefully if people start to internalize and remember those best practices as we move forward, that will really serve the whole community.
Let me jump in there, Dr. Vohra, it's Corin. Does it complicate matters for you when the county supervisors are part of a rally like that? That's clearly a large gathering, bigger than 50 people, which is violating one of the CDC guidelines and your guidelines. And they're violating your guidelines and CDC guidelines when it comes to masking. Does that complicate matters for you and your messaging when it comes to trying to protect this community?
Well, like I said, I'm very sensitive to the fact that we have a diversity of opinions. There's a lot of voices in this space right now, and people want to be heard. I totally understand that. In fact, I expected it. I really do. Like I've said before, I think I said this a couple of weeks ago, reopening is going to be more chaotic than shutting down. And that's really what we're experiencing now. What I'm hoping will prevail is a sense that we're all in this together, like the mayor said, and that we know how to proceed smoothly and gracefully and with the best guidance that the CDC and the state is providing, and what our local practitioners are telling us from the hospitals and on the medical side, just about how ready they are. And I think that we need to really proceed with that much caution, because if we go too quickly, we're really going to screw up the good numbers that we do have right now we're going to experience what they call a second wave, and that may actually overwhelm our medical systems. So we really do need to be mindful and be as careful as ever during this time. I'm not saying that we don't need to be thinking about and preparing to get into that next phase, but I think that it's really going to be everyone's responsibility to make sure that that we are responsible to safeguard our own safety, our family's safety, and the safety of the most vulnerable people in our community. So I understand, I understand that people want to be heard. I just hope that people can really abide by what we know are safe practices as they make their opinions known.
When it comes to overwhelming the system, right now you said 23 people with cases or suspected cases who are in ICU beds. Is that accurate?
Yeah, 27. That's
27.
right. Yeah, 27.
You know exactly how many ICU beds are available? I know there's an approximation of 150. Is that exactly correct?
Yeah, that's correct. But in terms of that number, that 150 includes people that do not have COVID that are currently occupying those beds. So really, it's a balance, right? The more people that come in with other conditions, the fewer beds that we will have for COVID patients and vice versa. And so we really have to proceed carefully because we want people that have any medical condition to be able to access this medical care. And if we overwhelm our system, then all of the unfortunate people that have heart attacks and strokes and car crashes, et cetera, won't be able to access the same level and the same standard of care that we expect to provide. So we really have, go ahead.
A related question is just how many of those 150 you can actually staff on a given day?
So staffing is something else that our hospitals are reporting. From what I understand, the staffing is adequate right now, but it's not unheard of that hospitals need to cut people's hours and sometimes even furlough some positions just related to some of the census issues that they've been having. And so staffing can change very precipitously. Again, being too confident in this time is really unwarranted because we really don't understand and can't predict too far into the future. And so we really have to take staffing, PPE, bed capacity, ventilator capacity. We really have to look at these data on a day-by-day basis, and we can't really project too far ahead into the future about how much staffing or how many resources we're gonna need based on today's numbers, because these numbers do change every day.
But they have enough of the techs and the nurses that they need specifically for those ICU beds for all 150 of them?
For now, we do. For now, as I understand it, the staffing in our hospitals is adequate. Staffing outside of our hospitals in some of our outpatient clinics has been challenging. As you know, some of our clinics have had to close down, not necessarily because of staffing, but really protecting the staff. And that really speaks to PPE. So some of our clinics, a lot of our outpatient surgical as well as dental, and I see Richard is here from SPOC, and he can speak to this. But basically, our providers are telling us that they're struggling to really protect their staff with enough PPE, and that's just right now when everyone is sheltered in place. Now, imagine if we move too quickly into a future phase, and then we have a lot more people accessing a lot more medical resources. That's really going to stress the whole system, and then we are going to be in a place where we don't have that. We have shortages of PPE, and that will be very frustrating. So I don't know, Rick, do you want to speak on behalf of SPOC, the Sierra Pacific Orthopedic Clinic, just about some of the staffing or PPE challenges that you've had?
Sure, thank you. So our challenges are we're ramping back up from whether it be an elective side, just office visits. So we're doing fine there. One of the things that we were struggling with was actually getting swab kits to be able to offer and make ourselves a testing site. So Quest was sending us as much as they could, but because we weren't in the different tiers of
priority,
yeah, outside of our subspecialty orthopedics, we weren't able to get that. So we didn't have 500 tests. We had 60 or 70 that we had to hold on to for our 200 plus employees and our 10,000 patients that may or may not need that. So we were hesitant, although we were able to get some, and we donated some of ours to CCFMG across the street because they have a testing facility. So we're helping them. Even though we couldn't do it directly, we're helping them indirectly. From a PPE standpoint, a burn calculator and things like that, we're okay because our population demographic, they're pretty healthy, and they're screened, not tested, but screened twice before they even get to the building, whether it be on the phone, via the app, and then when they arrive to the building. So our challenges were taking our subspecialty orthopedics and applying it to public health because we wanted to help. So we had to find different ways. For example, donating the app, the contact tracing app, things that we've talked about in the past.
Thank you, Rick. Your team has been stellar. You've really risen to the occasion of really answering all of the challenges with this pandemic, even though it's outside of your general scope of work. It's always inspiring to see the creativity and the flexibility that your team brings to any challenge. But yeah, thanks for speaking about that. And that's really just very typical of what we're hearing from a lot of other providers, is that they may not be prioritized for the supply chain. And so they really feel that they're not quite ready to reopen. If they do reopen and the supply chain gets interrupted, then they'll have to, cancel or postpone surgeries, which disrupts so many other things that people want to do. So again, from a public health perspective, we really just want to make sure that our healthcare system is ready to deliver at whatever level we need to. And when we say that we need to proceed carefully in a phased opening, that's exactly why we're saying that, is because we understand just how fragile our safety nets are. And we don't want to overwhelm them by everyone kind of stampeding into the next phase without really having clear communication and clear protocols to keep everybody safe.
I have one last question, and as regarding that demographic breakdown, it seems to be hitting the Latino, the Hispanic population the hardest. Is there any takeaways you get from the demographic situation at all, including that?
Well, it's something that we're watching. Like Dr. K said, we don't want to jump to any firm conclusions with the small sample size that we have, because I think that's a pitfall for all epidemiology studies, is you really want to wait until you have better numbers and more reliable numbers. But having said that, that definitely is a big population here in our county. We know that they're being affected in a way that is a little bit higher than the rest of the other ethnic breakdowns. We've been working hard with Spanish language messaging and with our Spanish language media partners to really try to get the message about prevention, about safety, about how to get tested to those populations. And we're not done. We're going to continue to work with them. Next week, I've already invited some of our community-based organizations that focus specifically on Hispanic groups to come speak with us during our media availability. So hopefully, if you can join us then, you can ask them directly about some of the ways that we're trying to really reach out and reach this population just on that issue, because that's something that I agree is a very important one to focus on.
Hey there, sorry to jump back on the Sanger question. This is Kirsten with Casey. Just wondering how many tests approximately can be processed at this new site? And then also, are there specific requirements for appointment only, like symptoms?
So I can answer that on behalf of the mayor. We're planning to do a total of 132 tests per day. So that's just the round number that the state provides. As you know, that site is capable of doing that many, and that's exactly how many we expect to do. So we're hoping to fill all of those slots with the online registration. And then your second question about symptomatology, certainly people with symptoms, we really want to get them tested. But even if you don't have symptoms, you can still qualify to get tested. and that's just based on there's an algorithm that the website has. And the first set of questions is whether you have symptoms, whether you're in a high-risk, vulnerable population like over age 65 or multiple other medical illnesses, or if you're a healthcare worker, first responder, or public servant, then we want to prioritize those getting tested as well. So whether you have symptoms or not, you'll find that you'll be able to get tested. You may not be able to get tested on the day or the time that's your first choice, but we feel like there's enough testing there that we'll be able to test everybody. Just to give you an example, at Fresno City College, where we've got a site stood up and running, we were able to do 100 tests yesterday, but that means we still had 32 tests that went undone. And so again, we just want to max out the testing every single day and make sure that we get that 132 number every single day.
Thank you.
Sure.
Dr. Vohra, this is Jim again. So tomorrow the governor is going to release some of the guidelines for businesses and whatnot to open up on Friday. And I know the counties are going to be able to give some sort of opportunity for other businesses to put in a special request to go ahead and open if they've got certain things that they have met. How are you handling all of those businesses in Fresno County that are going to say, hey, Dr. Vohra, we did all this, this, and this. We want to reopen. Do you have staff that's going to be manning a call center? Because I'd imagine there's going to be a lot of businesses that are going to step up.
Thank you for asking that question. We've already embarked down that path. We're certainly waiting for the governor's announcement and the state public health department's guidance about how businesses can reopen safely. But they've assured us that they are going to provide guidance in anticipation of this new phase happening as early as this next week. If you look on our website, off to the side, we have a tab that says interim guidance for reopening businesses. And we've actually been able to collaborate with some of our business community leaders, as well as our environmental health team, which, as you know, they're the folks that go out and inspect places like restaurants and employers. And so they actually have very deep knowledge about what employers can do and what they're expected to do just outside of the COVID realm. And we've really been able to utilize their skills to help us formulate guidance for reopening businesses. So if you click on that tab, that really gives you a good, detailed set of issues and questions to work through. Again, some of this might feel like homework, but we just want to make sure people are safe. And so we've just divided it up into ways that the business community and other business leaders and really any other place of business that wants to start reopening can think about aspects related to employee safety, customer and visitor safety, social distancing protocols, sanitation protocols, and we have references at the end to point people to even more websites and other good, useful resources to help them get ready to reopen. So again, we feel like this is the right thing to do at this time, is to introduce guidelines that will allow people to think about how to keep their customers safe, how to keep their employees safe, and make sure that their business is operating at the highest level of safety and hygiene that we can expect, just because that will serve all of us in future phases as we get ready to reopen.
That's
so
great.
Again, like I've said before, it's really going to be up to the state when they decide. It sounds like they've already given some preliminary notifications that they're ready to have some businesses reopen, and that's fantastic. As we reopen more and more sectors of our economy, I think all businesses, really everyone who's currently being asked to stop their operations, as they get more and more permission to open up, they will need to work through this kind of a similar guidance. And this really aligns really well with testing, contact tracing, safety, prevention. These are all pieces of a puzzle that interlock together. And you'll see as you work through these questions, they really set us up to be successful and quick and agile with doing the things like testing and tracing that we know we're going to need to do in order to really keep this pandemic contained as much as possible.
Sure.
So
The
go ahead.
governor did give a carve out, it sounded like the other day, 2 counties to specifically say, okay, this business may not fall into a phase 1 or a phase 2 as per him, but that these businesses could then apply with a special application to you and say, hey, I've met all this stuff. I think I'm ready to go. How do you prioritize where you send your teams to determine whether or not that business is A-okay to go ahead and open up in some way, shape, or form?
Yeah, that's a lot of that is still to be worked out. We know that there's going to be pathways for different sectors to try to get authorization, and whether that's going to be on a business by business level or a county by county level, that's yet to be worked out. We feel like what's going to happen is we're going to move from the current phase, which they use a little bit different terminology in Washington State, but we're actually in our phase 1 now, and we're going to move into phase 2, as I understand it. But regardless, we're going to move into a different phase as early as this weekend, and then to move from this different phase into a future phase, that will be county by county or region by region. And we're still waiting for what that guidance will look like to see exactly how much the state is going to allow us to do locally. But hopefully we'll craft something that's rational, feasible, and something that everyone can agree is a good, safe way to proceed. And again, we're at a point where we're really looking for feedback and guidance from our community partners because they know best what will work for their own sectors and what they can accomplish and what they need our help with.
Dr. Vohra, this is Tim Sheehan with the Fresno Bee. You talked about the importance of not moving too hastily so as not to overwhelm the healthcare system, medical system here in Fresno County. And that leads me to the question, I think it's been asked before, but I want to reiterate the question. Do we have information, or what information do we have about the numbers of healthcare professionals who have tested positive at some point during this 2-month outbreak that we've had here for coronavirus?
Great question. That is something that the state is tracking, and so that's something that should be available on the statewide dashboard. I know it's not something that we currently offer here locally. I can tell you that the numbers are exceedingly small, so that even though we do have some clinicians and clinical personnel that have been affected with the COVID infection, that's really something that hasn't been a huge number of people, but it's something that we are mindful of. And really, we have gotten great collaboration with our hospital partners in helping us track these infections inside the hospitals. And they've been, since day one, very cognizant of all of the safety and the precautions that they need to be putting into place to keep their employees safe. And so we're very satisfied with how the hospitals and the other medical providers are doing in terms of taking all of the necessary precautions to make sure that their employees are kept safe. And whenever there is a patient or a provider who has a positive test result, they're very aggressive about making sure that that person is notified and that the contact tracing gets done. And in fact, that's something that the hospitals themselves are helping us do. So we're very happy with how that process is working out.
Thank you.
Dr. Vohra, this is Joe Keita from the Bee. I wanted to kind of follow up a little bit on the ICU bed numbers. So you mentioned that there are 150 total ICU beds in Fresno County, and 27 of them now are occupied with COVID patients. Is that accurate?
Yes, that is.
And how has that 27 number fluctuated? Is that on the upswing or has that gone down? And is that something that's listed every day on the county site?
You know, the 27 number I actually pulled off the state site, which breaks down the hospital statistics by county. But that is something that the hospitals do report. It's something that I do try to track. I can tell you that the number's been creeping up. For example, it was in the 12 to 15 range all last week, and now it's kind of going up. I was on a call during the noon hour with my medical partners the UCSF Fresno Medical Center, and they shared that they have several patients on ventilators. The total number of patients at Regional Medical Center is 9, and that includes 3 patients that are actually on the heart-lung bypass machine called ECMO, which is the extracorporeal membrane oxygenation, or ECMO device. So these are pretty sick patients. I mean, these people are, only qualify for that heart-lung bypass if they have an expected mortality of 100%. And so it's a very, very sick population of patients that are in these ICUs. However, right now, they're getting all of the attention that they need. As they get more and more patients in the ICUs, you can imagine that that the system will be more and more stressed. And so that's why we're watching this so closely, is because we know that along with the ICU bed capacity, our ventilator capacity will be stretched, our ECMO machine capacity will definitely be stretched, et cetera, et cetera. So in addition to the ICU beds, it's really all of the resources that are required to take care of these patients. And so every single thing we can do to prevent an admission, and especially an ICU admission, is definitely worth doing. And that's really up to all of us, is, the more we can slow the spread by wearing our masks, by washing our hands, by keeping our distance, the more we can protect the healthcare system, and especially the really high, the really high critical care resources that we know might be required for some of these patients.
So of that 150 beds, are all of those occupied, or are some of them open for patients with other ailments? Or?
I think that's just the total capacity. And then the number that's occupied with the COVID patients is 27. And then there's probably, a few dozen more that are, I'm sure there's a few dozen more that are non-COVID ICU patients, just because our hospitals are always busy with non-COVID patients as well. And so at any given time, there's many dozens of patients that require critical care here in our county that the ICUs are taking care of.
Great, thank you.
Sure.
Dr. Vohra, one last question from me. I know people have warmed up to the idea of wearing masks, mandatory masks now in all kinds of stores, flights, what have you. I saw the first comment today from a teacher. One of my kids' teachers said that when they were picking up something at school, they had to wear gloves in addition to a mask. Okay. Where do you stand as far as gloves go? Is that going to become mandatory next? I've seen differing opinions on the use of gloves. And it might be worse.
That's a good question. I do, whenever I'm doing my errands, et cetera, with the grocery stores, I do see people sometimes wearing gloves. I think that, hand hygiene, whatever you could do to do hand hygiene will work. Soap and water is best, but that's not always available, and I understand that. Then we have the alcohol-based hand gels, which again are pretty good. However, they're not always available, and they can be expensive, and they also can be very irritating to people with fragile skin. And so if you do fall into that category, then gloves do make sense as a way to protect your hands, especially if you don't have access to soap and water whenever you need it. It would make sense to wear gloves. And also, I think wearing gloves is just a reminder, like, don't touch your face, because if you have gloves on, then hopefully that's just an extra barrier to where you're really not going to touch a lot of extraneous items the way that you naturally would. So I do think that there is a value to using gloves. I think mandating it and requiring it can lead to misuse, because then people will be forced to use maybe soiled gloves or really use them inappropriately. So I don't really see mandating gloves as something that I really just never seen that even floated as an idea at the state level or at the CDC level for the general public. Obviously, in healthcare, we use gloves all the time. And there's a lot of other professions where gloves, like food preparation, et cetera, where gloves naturally make sense to use. But for the general public, I think it's really up to everyone to make their own individual choices regarding how they want to take care of their hands and make sure that their hands are clean as they're going about their day. Regarding the school, dropping stuff and picking stuff off, dropping stuff off and picking stuff up at school, that's kind of interesting. I think that's another place where, again, having that extra layer of safety protects everybody. And so if especially the workers are using gloves, then that may actually be worth doing. But again, I'd have to know more about exactly what activities they're doing to let you know if that was absolutely necessary or just an extra precaution. Sorry, I cut somebody off.
No, it was me. No worries. This is Dr. Kumar. I wanted to add that the risk here is not going to be through the skin. So really the protection with the mask is because you're going to be getting this probably through respiratory droplets. So it's protecting people from you breathing it out or coughing it out, as well as protecting you potentially from breathing it in. With the hands, what's the problem is you're not going to get it just from having it on your hands. You're going to get it because you touch something and then you put those hands to your mouth or your nose, your eyes. So really, if you're wearing gloves and then you're throwing them away, so you've protected your hands, that's going to protect you. But also just washing your hands if you come into contact with things will also protect you. But if you're wearing gloves and then touching your face, it's going to have the exact same result as somebody not wearing gloves. So that's why the masks are much more important than the gloves. It's really just try and keep your hands clean and away from your face.
Great, thank you both.
Dr. Vohra, can you talk a little bit about contact tracing? I know, I don't know if it was Monday or Friday, you talked about a team in place for Fresno County. Is that team ready to go? Has that team started working?
It's coming along. Definitely more to come in future sessions. What I can tell you is that yesterday afternoon, the state asked us to send names of people that are ready to start Contact Tracing Academy. This sounds so cool. I wish I had more time to do it, but it requires 20 hours of time to do virtual training through the California Department of Public Health and some other partners that you're going to hear about. I think they're going to announce them as early as this week or maybe next week. But it's a really cool team of people that they've gotten together. And they really want, like I said, virtual training done for people to do contact tracing, and then another team of people to do medical investigation, and then a third team of people in every county that can actually train others. So kind of a train the trainer model is what we call it. So they're already looking for people to get registered into this. And I have the training schedule right here in front of me. It's going to start Friday, first thing in the morning. You're going to get an introduction to public health, epidemiology 101, COVID-19, overview of contact tracing. And then Monday, Tuesday, and Wednesday of next week, again, I wish I had time to take this myself, but I am trying to get people recruited to do it. But they will go through overview of case investigation, HIPAA and confidentiality issues, interviewing techniques, isolation and quarantine and what that means, interviewing skills, understanding communication and isolation, coaching people through basic health issues, dealing with challenges, and addressing common challenges when it comes to contact tracing. So again, really putting together the building blocks to teach almost anyone that has the interest and the motivation to learn how to do contact tracing. And like I said, I'm going to go straight to Mayor Gonzales as soon as I get more information about this and say, please give me people from the city of Sanger. Then I'm going to go to all of the other civic leaders and say, please give me a few people from each of your divisions so that I can teach them how to do contact tracing. And I expect our business community, all of our stakeholders in our schools, our community-based organizations, our faith-based organizations, our public responders, and obviously our medical leadership in our hospitals to hopefully contribute personnel that can be employed as contact tracers. And then we will train them. We will get them oriented to the app that we're going to use, the software that we're going to use, and then we're going to embed them right back into their agencies so that they can help do contact tracing. Now imagine if you're an employer of like 3,000 people in somewhere in the food supply chain. Now you're going to have someone that's specially trained to do contact tracing so that if your factory or if your work site becomes a place where COVID-19 outbreaks happen, now you have specially trained contact tracers that can help work, through that investigation with public health. Then they can talk to your employees and they can also talk to public health. They understand your work site and they also understand all of the details of contact tracing. So this is really how we're going to go forward, is we really want 300 people that are specially trained, but then also able to work with all of these different scenarios to help us get the contact tracing done wherever they are. I'm very excited about this. This is one of the most innovative public health projects that has come along in decades. The state is committing all of its resources to make sure that it's successful. And we're going to step up and hopefully be part of that first wave of people that get trained to do contact tracing. So again, please publicize this. We're going to have more information about this. We're going to have more opportunities for people to come volunteer with us and hopefully come get employed with us so that they can become contact tracers as we learn more about the structure of these teams. I've already got my colleagues at UCSF Fresno interested in this. Some of our residents from the UCSF Fresno training program are going to be our first wave of contact tracers. Obviously, we've got our own homegrown team of contact tracers that have been working super hard for the last couple of months here at the Department of Public Health. And now they're going to get a huge boost with this statewide initiative on contact tracing. So thank you for asking that. Once we actually have people that have taken the course, we will invite them to come talk about all the things that they learned and really where we can go next with this really important initiative.
Again, how many people are you looking to hire, and are you guys working with the state for this?
The standard, yeah, the state, I think statewide is going to be tens of thousands of people. And the standard that I've seen referenced is 30 people for every 100,000 population, which means that we need about 300 contact tracers throughout the county. And like I said, I want them in every city, in every different work site and scenario that we can get them, just because that's going to really help us be stronger and be ready to really contain this epidemic everywhere where it pops up.
Thank you.
Thank you. All right, I think we went over, so thank you all for your time. Really appreciate it. We're asking about haircuts. I think a couple of you asked about haircuts. I actually got mine. I had a home haircut just because I had a set of clippers. So that's how I got mine. I know it's a challenging time, and I'm just asking everyone to be patient as we work out and get the best guidance from the state. And as you can see, this is my 3-year-old who was able to help me get my haircut, and she gave me a really good rate on that. So I really appreciate it. And I think we will end. That's my 5-year-old, and she got in there too. She ended up buzzing her own hair for a minute, but we got it done. So.
Did you give her a tip?
She got Otter Pops. They work for popsicles.
That's even better.
But yeah, I know that that's a sensitive issue. I'm very aware of all the different sides of it, and you know, more to come. I look forward to the dialogue. Please be civil, please be safe, and please teach each other how we can all move forward and move into the next phase gracefully. So thank you all very much for your time.
Thank you, sir.
Thanks, Mayor. Thanks to all of our featured speakers.